Hello, Dr. Goodwin. This is Dr. Shah.
Good morning. How are you?
Good morning. I'm doing great. How are you?
Okay. It's good talking with you this morning about the importance of having one's heart ready for the winter and about heart disease even beyond that. But before we start, I want our Health Power audience to know that you're a cardiologist or heart specialist and that you're affiliated with the widely recognized Methodist Hospital System in Houston, Texas. So it's great having a chance for us to talk today.
Well, thank you for having me. It's my pleasure.
Right. Now, as you and I both know, heart disease is the leading cause of death in the United States. So it's something that people can live with if they know how to prevent some of the major complications. But either way, it's the number one killer of people in the U.S., so it's very important that we're discussing it. Now, I mentioned the winter, so could you tell us why the winter is so important in that about 30% greater chance of, or greater risk of death from heart attack during the winter than the rest of the year?
Absolutely. So, as you correctly pointed out, heart disease is the number one killer. We have more than 700,000 folks having heart attacks every year, and almost 20% of those are fatal. But what is really important is to realize the challenge the winter months poses. Between December 25th and January 7th, that's when we have increased heart attacks about almost 30% compared to the rest of the year.
Just
Now,
between December 25th and when?
January 7th. And,
Uh-huh.
and what is also good to note is out of the whole year, one day, December 25th, is the number one day when we have more heart disease related deaths than any other day of the year. During winter,
That's very interesting.
yes, it is.
It sounds like it's stress related.
Well, I mean, there are many theories. So one could be the stress, one could be the heart, which has not been used to doing a lot of activities, suddenly gets all stressed out. The oxygen demand goes up. There is much more stress in the heart muscle. But then there are also other various theories. So, for example, we believe that there are some hormonal level fluctuations, especially in the cortisol level, which actually lowers the threshold for a heart attack. We also realize that there is cold-induced vasoconstriction of those blood vessels, and then also the prevalence of illnesses such as flu. I mean, we do know that inflammation and flu-like illnesses make those plaque vulnerable, make those plaque unstable, and potentially increase the risk of heart attacks.
But when we mentioned the winter, I thought we were talking about several months. But from listening to you, there's a period of about 2 or 3 weeks when the rate is very high.
Absolutely. I think those are the highest point rates. But again, during the entire months of winter, especially up north, we have really high risk of heart disease. So we must be vigilant as doctors, but also we ought to teach our community, our folks, to be more aware of their heart disease, their symptoms, and get them evaluated rather than wait on it.
Now, are those data from CDC or NIH or where about the high incidence of heart attack in the winter?
Yeah, this is actually public information. You can go to any of the websites, government websites, and pull out those data. It is actually universally available, and this has been observed year after year after year. And the 30% increase rates. Yeah, absolutely.
And what are some of the main findings associated with heart emergencies in the winter? Is it mostly from shoveling snow? What is, if you had to name the 3 things that are thought to be most associated, what would you think they are?
Yeah, I mean, look, any kind of exertional activity during winter months probably utilizes more oxygen, really has more demand. So most of those folks start having chest pains or angina, as we describe them, possibly with radiation to the left arm, left jaw, maybe even to their back. But we also know that a lot of those patients who are having a heart attack never have the typical angina. Either they get short of breath, they're getting tired, they may be getting heartburns. Like, for example, in women, heart disease in women is so tricky. Most of the women are either asymptomatic or actually have atypical pains. So I think detection is such a key, and not ignoring those symptoms is very valuable.
Right. Okay. And are there special devices that can be used to treat coronary artery disease? I guess when we talk about heart disease and heart attack, we're primarily talking about coronary artery disease.
Absolutely. So, as you know, coronary artery disease is nothing but plaque formation, cholesterol plaque formation inside our coronary arteries, and as they grow and narrow further down, they actually lead to a heart attack. So, during an angiography, where we run catheters from one of the leg artery or the wrist artery, when we take pictures, we identify those blockages. Once we identify those blockages in those coronary arteries, that's when we come up with a therapeutic plan. Now, some blockages can be fixed or can be treated with medications. There are some advances in our medical therapy which are tremendous. As you also know, some of those disease is so widespread and so diffuse in their heart that those patients require bypass surgery. But the biggest advances in cardiovascular sciences, if anything, has to be regarding stents. For the last decade and a half, almost 15 years now, we've been doing those coronary stents. Now, as you know, coronary stent
Now,
is...
Dr. Shah, you and I as physicians know what a stent is, but for the lay audience, the general population, what would you say a stent is? Is it a tube that goes in, or how would you define it?
Sure. So stent is inserted via that catheter which has been inserted in the leg artery or the wrist artery, and over a wire we actually advance this stent and then open it up with the use of a balloon. And as we open up this stent, it actually opens up the blood vessel and restores oxygen and blood flow to the heart muscle. So it is a metallic mesh tube, like a little cylinder, and it comes in varieties of sizes and lengths and diameters, and we can actually customize it based upon the person's heart anatomy. These stents, historically, we started with what are called bare metal stents. They did not really have anything special about them, and they used to fail in about 1/3 of the folks we did. But then in the last 10 odd years, we have come up with drug-coated stents. So now these stents have a coating of a drug which actually prevents scar tissue, which prevents further re-narrowing of those blood vessels. And they've done a tremendous job. However, in the last few years, last couple of years especially, we have come to realize that the polymer which is used for the drug molecule to be attached is a problem. The polymer is a source of chronic inflammation. The polymer creates further events such as heart attacks and plaque rupture and blood clot formation. And there has been so much science and energy put behind in trying to get rid of that polymer. And that's where the next technology...
Is the polymer a drug?
No, polymer is just a layer, almost think of a little plastic layer, very thin layer, which is actually on the surface of the metallic stent, and on the other side of the surface is where the drug molecules attach to that. And that's how we deliver the drug molecule. We require the polymer to deliver the drug molecule, but the drug molecules go away in the first 3 months. Unfortunately, the polymer stays on. And that's where this new stent called Synergy has tremendous excitement. Because Synergy is a stent where not only the drug is delivered, but then the polymer biodegrades, bioabsorbs. This is a first in US. FDA just approved that. There's nothing like this in US before this. And that will allow those vessels to heal long term.
I see. All right. So that's very interesting, and I know we have limited time today to talk, but it was very interesting hearing about this. And the new stent technology that you're speaking of is called what? How do you spell it?
Sure, it's called Synergy, Synergy. It is made by a company called Boston Scientific. And actually, for folks who are really interested to learn more about it, I encourage them to visit their website. It's Boston's...
Let's end by giving the website. Where can we get more information?
Sure, it's bostonscientific.com/synergy.
BostonScientific.com
/synergy-US.
Synergy-US. Let me just repeat that. It's www, right?
Yes.
www.bostonscientific.com/synergy-US.
Synergy-US.
Synergy-US.
Perfect.
Very good. Well, I'm sure some people will be interested, both health professionals and the general population, in learning more about Synergy as a stent technology advancement It was great having a chance to talk with you today, and best wishes for your continued work.
Thank you so much. It's such a pleasure. Thank you very much.